All right, ready for a deep dive. Today, it's all about community health workers. They're making a real difference in healthcare. You've shown interest in this field, which is awesome, so we're going beyond the basics today.
Absolutely. We're going deep beyond the job description. We're looking at how this career really plays out in our communities.
Using this awesome guide from RoleCatcher, it's amazing what these CHWs do. They're like everyday heroes,
Yeah.
just without the capes.
Right, no capes, but they bridge this gap, between healthcare systems and the people who need them most. These are folks who are trusted voices in their communities, which is huge.
So what does their day actually look like? What are they doing out there?
Okay, picture this. A CHW might start their day with a diabetes management workshop, but they're tailoring it to the culture of the community. Later, they could be visiting a new mom, maybe offering breastfeeding support and connecting her with resources like childcare assistance. And then, by the evening, you might find them advocating at a town hall, pushing for healthier food options in an underserved neighborhood.
Wow, talk about wearing many hats.
It's no wonder RoleCatcher says you need social skills and cultural sensitivity. Those are key.
For sure. You need those, plus adaptability and empathy. It's about really tuning into the community's needs. This isn't just about info dumping. It's about becoming a part of the community, building trust as they go.
Makes sense. The guide also mentioned they develop health programs. What's that like, practically speaking? Are we talking big initiatives or more local stuff? It can actually be both. A CHW might be rolling out a national program, like vaccinations, but they'll have to adjust it to fit their community's specific needs and worries. Or they might see a need in their community. Like maybe there aren't enough mental health resources for teens, so they'll take charge and create a program themselves, being proactive.
So it's not just following orders, it's about problem solving,
Yeah.
right? Understanding a community's challenges, their strengths, which probably means experience in knowing the community is just as important as a fancy degree.
Exactly. A CHW who's really ingrained in their community. They might not have a master's in public health, but what they do have is super valuable firsthand experience. They know what the community needs, and most importantly, they have the trust of the people. That's powerful.
Yeah, that insider perspective. Speaking of, RoleCatcher mentioned specializations. What's that all about?
Think of it like a doctor specializing, but for the whole community. A CHW might focus on mental health, or managing diabetes, or maternal health, even substance abuse prevention. There's a lot.
So, like, if someone's really passionate about the opioid crisis, they could become a CHW focusing on that.
Exactly. They'd have the knowledge, the resources, and they'd get the cultural piece to really make a difference. Think about it. Helping a whole community deal with addiction, supporting families, getting people into treatment. That's what a specialized CHW can do.
Powerful stuff.
Yeah.
But let's be real. The guide mentions the emotional toll of this job. And the salary isn't exactly, top tier.
Yeah, it's not always easy seeing these health disparities firsthand, dealing with tough social issues, advocating for communities facing like systemic roadblocks. That can be draining emotionally, mentally. And yeah, many CHWs, they're doing this incredible work for, well, not enough money. That's something the field needs to fix.
Definitely. So how do they deal with that, with burnout? Are there support systems in place?
That's so important. And yeah, thankfully there are resources. A lot of organizations get it. They know self-care matters. So they offer supervision, support groups, even mental health services for their CHWs. Plus, just connecting with others in the field, networking, mentoring, sharing experiences, venting frustrations with people who get it, that makes a huge difference.
Building that sense of community, not just for them, but for their own well-being too, right?
Yeah. Exactly. It's all connected. A CHW who feels supported, they're in a much better place to support their community. Which brings us to impact. I think it's important to talk about the real, tangible ways they're making things better.
Yeah. Let's get into it. What kind of success stories are we talking about? What's the real-world impact of CHWs?
Oh, there are so many. In some places, they've been crucial in bringing down infant mortality rates, providing that culturally sensitive prenatal care. In others, they've helped slow down infectious diseases, promoting vaccines, fighting misinformation. We're even seeing them make a dent in chronic stuff like diabetes or heart disease. They empower people to take charge of their health, make lifestyle changes, get access to care.
It's amazing to hear about the real impact. It's clear CHWs are changing healthcare in so many ways: prevention, education, advocacy, and like we talked about, tackling those social factors that affect health.
Absolutely. They're making change happen. And get this, a study, I think it was in the American Journal of Public Health, found that CHW programs can give you a 5-to-1 return on investment. So, better health and saving money.
Now that's a win-win. But a field growing this fast, there have to be some challenges along the way, right?
Right, you are. One of the biggest hurdles is making sure training and professional development are consistent. Because the thing is, CHW roles, they're all over the map. So we need solid training programs, standardized ones, to give them the skills and know how to be effective.
Makes total sense. We got to equip these frontline heroes. And I'm also thinking we need more research, more data to really prove the value of these CHW programs, especially to people with the purse strings, the policymakers.
100%. We need that hard data to fight for more funding, bigger roles for CHWs, and policies that actually bring them into the healthcare system, make them a real part of it. And that's actually a place where people interested in this career can make a difference. Get involved in research, track data, share your story. All of that helps shape policy.
Wow, a chance to build the future of the field. So for our listeners who are ready to jump in, explore the CHW path, what are some practical next steps?
Well, RoleCatcher is a great place to start, obviously. Their interview prep section, pure gold. And they link to groups like the American Public Health Association. You can dig into research there, find advocacy work, and connect with people.
Those resources are like gold. And for those still on the fence, unsure if it's the right fit, what would you say?
Listen to your gut. Follow what you're passionate about. If you want a career that, I don't know, it's fulfilling, personally and professionally, where you can truly make a difference, CHW might be your thing.
I love it. And like RoleCatcher says, the best way to see the future is to make it yourself, right? So go for it. See what's out there. See how you can help build a healthier, fairer world through this whole community health movement.
Couldn't have said it better myself.
On that note, we'll wrap up our deep dive into the world of community health workers. This is really just the start. There's so much out there, information, resources, chances to get involved. So until next time, stay curious and keep making a difference.